Recently, the New England Journal of Medicine reported that over 40% of all Americans suffer from some sort of heartburn at least once a month. Heartburn can be a symptom of a much more serious condition known as gastroesophageal reflux. Typical symptoms of this condition include painful heartburn, indigestion, regurgitation, difficulty in sleeping, hoarseness, sore throat. Gastroesophageal reflux occurs when acid from the stomach surges upward into the esophagus. The result is painful heartburn. In the normal anatomy, a valve at the end of the esophagus keeps the acidic gastric juices from rising up into the esophagus. It is when this valve is malfunctioning that reflux occurs. The valve defect may be congenital from birth, or it may have become weakened as part of the normal aging process. Although most cases of reflux are caused by this weakened valve, there are other causes that need to be assessed by your doctor. Other patients may suffer from what is known as a hiatal hernia. A hiatal hernia is caused by an opening in the diaphragm, which is a flat muscle that separates the lungs from the abdomen. When the opening in the diaphragm enlarges, a portion of the lower esophagus, and in some cases the stomach itself, herniates or pushes into the opening. Stress, heavy lifting, pregnancy, and the normal wear and tear of life on the body can cause a hiatal hernia. If untreated, hiatal hernias can cause ulceration of the esophagus, narrowing of the esophagus, difficulty in swallowing, respiratory problems, and possibly even esophageal cancer. While medical therapies can help reduce symptoms, the basic abnormality of the malfunctioning valve is not addressed. Here's the good news. Thanks to minimally invasive surgery, chronic heartburn can be cured in many cases. In this safe and highly effective procedure, the surgeon wraps a part of the stomach, known as the gastric fundus, around the lower esophagus. This lengthens the lower esophageal sphincter and improves the performance of the sphincter, preventing the flow of acids from the stomach into the esophagus and eliminating heartburn. With traditional open surgery, a large 7 to 10-inch incision must be made. Because this cuts across muscle tissue, there can be significant post-operative pain. Infection in and around the incision can also occur. A large scar will be visible following the operation, and a lengthy recovery from 6 to 8 weeks is possible. With minimally invasive surgery, one small incision is made for a fiber optic camera, which allows the surgeon to view the anatomy for the procedure. 3 to 5 additional small incisions are then made for other surgical instruments to be inserted into the abdominal cavity. Post-operative pain is significantly reduced because the small incisions do not cut across large tissue areas. Following the operation, the surgeon will place 1 or 2 stitches in each of the access points. Because of the minimally invasive nature of the procedure, scarring is significantly reduced. Patients who choose minimally invasive surgery over open surgery usually stay in the hospital from 1 to 3 days instead of the 1-week period required with open surgery. In many cases, recovery time can be as little as 2 weeks compared with 6 to 8 weeks with open surgery. Potential risks and complications of the minimally invasive procedure are similar to those associated with open surgery, such as reactions to anesthesia and medications and a minor risk of bleeding and infection. There may also be some slight discomfort, swallowing, belching, or vomiting. It's recommended that you stick with liquid or soft foods for a few days after surgery to alleviate this problem. You should know that if complications do occur during the operation, your doctor may choose to perform open surgery. With minimally invasive surgery, you can get back to all the things you love to do in almost no time at all. And isn't that where you really want to be?